Do you suffer from chronic dryness in your eyes or mouth? Have you been diagnosed with Sjogren's? Would you like to learn healthy lifestyle tools that can help you heal naturally? Hi, my name is Dr. I'm a board-certified rheumatologist who practices integrative medicine in Hawaii. Today's topic is healing from Sjogren syndrome naturally. I'm going to briefly summarize information about Sjogren's from a Western medicine standpoint, discuss contributing factors, and talk about healthy lifestyle tools including juicing for managing it. Sjogren syndrome is a common autoimmune disease affecting approximately 0 to 1% to 4% of the population, typically impacting ladies between age 30 and 50. The most common symptoms involve dry eyes and dry mouth in 90 to 95% of patients. However, it can also involve parotid gland swelling, vaginal dryness, fatigue, joint pain, and joint inflammation in some patients. In most clinical settings, the diagnosis is made based on the history of dryness and lab tests with autoantibodies SSA and SSB. The gold standard is the Celery gland lip biopsy, literally lip biopsy, taking a sample from your lip, confirming immune cells infiltrating and attacking your glands. But we don't do this very often due to the discomfort involved in this procedure. The severity of symptoms varies depending on individuals. For example, dry eye symptoms can range from foreign body sensation, pain, burning, red eyes, and blurry vision. Some people feel like sand is in their eyes all the time, requiring frequent eye drop use. Symptoms of dry mouth can also involve burning sensation, change in taste such as metallic taste, food being stuck in our food pipe, and GERD, reflex disease. Body makes about 1 liter to 1.5 liters of saliva per day. Saliva has an important role in maintaining healthy pH. And without this buffer, your reflux disease can get worse. People with extensive dryness can develop dental caries more easily due to the lost protection from saliva. Treatment for Sjogren syndrome in Western medicine is mainly symptomatic, involving eye drops, punctal plug in some cases for dry eyes, and sugar-free xylitol gum or lozenges for dry mouth. Medications such as pilocarpine or cevimeline are also used. We will talk more about these medications in a bit. Sjogren syndrome is an autoimmune disease where our own immune cells are attacking our glands, reducing their function. Our bodies are gifted with an amazing ability to compensate. When a problem of this degree is occurring, it usually means that there are multiple factors feeding into the disease process. What are some contributing factors? First, medications. Did you know some of the medications you take can also directly contribute to dry eyes and dry mouth? Here are some common causes. Diuretics for heart failure and blood pressure, such as Lasix and ACTZ, can contribute to whole body dehydration, making people more susceptible to oral and ocular dryness. For oral dryness, antidepressants in the class of tricyclic antidepressants such as amitriptyline and antihistamines such as cetirizine, loratadine are common causes. These meds can work synergistically with other contributing factors. Lifestyle factors are a huge component of causing dryness in Western culture. Here are some big factors for dehydration. First, let's talk about caffeine. In this society, we don't drink enough water. For many of us, coffee is the first thing that touches our mouth after waking up. Many of us don't drink pure water, but consume caffeinated drinks such as coffee, soda, energy drink throughout the day as a source of hydration. These are very poor source of hydration, as you can imagine. We also consume fast food containing very low water content. Second, tobacco and alcohol are big contributors for dehydration. So if you have Sjogren's, you definitely want to avoid these. Third, IBS and IBD. Most patients with autoimmune diseases tell me that they have chronic ongoing gut issue, which makes sense because gut is the headquarters for our immune system. Our gut is the portal between outside world and inner world, so there are a ton of immune cells in our gut. And our gut is the headquarters for our microbiome, which closely interact with our immune system. For patients with IBS or IBD, with chronic constipation or diarrhea, often there's absorption issue in the large intestine. So it's not usually just an issue with the gland tissues. It's a whole body problem. We have to eat an anti-inflammatory diet to make our gut favorable to healthy bacteria, not harmful ones, so that they can be kind to our immune system. You get the big picture, yeah? Fourth, screen use. We have a tear film, which is made up of 3 layers that works together to keep our eyes moist and healthy. The middle layer is an aqueous layer made of fluid. When this dries up, we feel that dryness. Symptoms can worsen as the day progresses due to the evaporation of ocular moisture. Prolonged screen use can contribute to the thinning of the aqueous layer, making the problem worse. Some people sleep with their eyes open, which can lead to further fluid loss from the tear film. They can benefit from eyelid tape to keep their eyes closed at night. Next, stress. Stress is another big factor that affects our gland function. Gland secretion and saliva production belongs to the parasympathetic nervous system, which governs relaxation. When we are relaxed, for example, let's say we're eating a beautiful meal with our family, laughing, the parasympathetic nervous system kicks in and acetylcholine is secreted. Acetylcholine is the predominant neurotransmitter in the parasympathetic nervous system. With relaxation, you make acetylcholine, you make saliva, and your gut moves properly, allowing digestion to happen. On the other hand, if you're stressed, the body goes into fight or flight mode, which is governed by the sympathetic nervous system, the opposite of parasympathetic nervous system. The body makes adrenaline instead of acetylcholine. Blood and nutrients are sent to the fighting muscles, such as your neck and shoulder, to either fight or run away more efficiently. The body shuts off non-essential functions such as digestion. You don't care about digestion when a bear is chasing you, just like you wouldn't renovate your bathroom while a hurricane is going through your town. So we need to return to a state of relaxation in mind and body to make our digestive and gland systems work properly. Some of the Sjogren's medications such as pilocarpine and cevimeline, brand name Evosac, these medicines mimic acetylcholine, the neurotransmitter of the parasympathetic nervous system, to stimulate glands to produce saliva and tears artificially. They push the gland button all over the body and can cause excessive sweating in different areas. It's like bypassing the natural body process of relaxation. If you're already taking these medications and they are working for you, that's great, but it is important to optimize your lifestyle so that body can do this for you naturally without meds. So here's the main point for this talk. So you have dry eyes and dry mouth. What do we do? What does a holistic approach look like? As we discussed in the past video, a holistic healing program for you and for your family, we should start with optimizing your health in 3 big areas: structural health, nutrition, and mindfulness. If you haven't watched that video, I strongly encourage watching it. For structural health, we need to exercise. The best form of exercise is what you can do consistently. If you're not exercising regularly, walking may be a good starting point. Some people have dryness in their eyes and mouth, but water pools in different places like legs at the end of the day. We need to move our body to circulate fluid properly throughout the body and remove waste product through our lymphatic system. It's a whole body issue. It's not just gland problem. When we move our body, muscle contractions help with mobilizing fluid, so it goes where it's supposed to go. So exercising is very important. Next, for nutrition, eat a 70% vegetable diet. For your plate for your meals, 70% of it should be filled with veggie. I'll tell you why in a little bit. The daily water consumption goal is your weight in pound divided by 2. If you're 160 pounds, 80 ounces of water per day is your goal. If you're 120 pounds, 60 ounces is your goal. Avoid processed food and refined sugar. Then mindfulness. Meditate, pray, do earthing, do breathing exercise throughout the day to keep your stress level in check. The body strives to exist in homeostasis, a balance between the sympathetic and parasympathetic nervous system. Due to poor lifestyle choices, stress, obesity, and toxins, this balance goes out of whack, leading to chronic inflammation and diseases. I encourage you to optimize your water consumption. For some of you, if you already have venous stasis with water pulling your leg, increasing water consumption might cause more swelling. Your body's not handling the water very well. If that's happening to you, or if you're struggling with Sjogren's despite of lifestyle optimization, I recommend the following. Celery juice. Many of my patients are juicing every day. Celery juice is the most common type of juice that we use for dryness. Celery is a nutrient-packed vegetable. Another amazing feature is that 90% of celery is composed of water. Think of it this way. Celery juice is a life-sustaining fluid for the plant. It is more similar in composition to your own serum than water. For some people with chronic energy depletion, chronic gut issues, it can offload some work for the body and help with normal cellular function. Celery packs amazing nutrients such as phytochemicals that cool down inflammation. Sjogren's is an issue with chronic inflammation and also lack of body fluid. Celery juice can help with both. In chronic inflammation, our immune system is very unbalanced. Our immune cells' original function is to protect us from infection. They make this bomb called free radicals. This bomb is stable when there are 2 electrons in the outermost orbit. Our immune cells take 1 electron out to make this bomb unstable and use it to kill germs. In chronic inflammation, this bomb goes off in the absence of infection, damaging our own cells. Phytochemicals work as antioxidants, which means they donate electrons to their neighbors, neutralizing the bomb. This is how phytochemicals cool down chronic inflammation. Phytochemical is a big reason why we should eat that 70% vegetable diet. In most cases, when you're tired, you are dehydrated. I don't have Sjogren's, but I use celery juice myself because it not only improves my hydration status, but also makes me feel more energized throughout the day. Of note, per food scientist, once it's juiced, the nutrient of celery juice gets destroyed within 72 hours. If you want to try juicing, the goal is to make it fresh and consume it within 24 hours for the optimal benefit. For your daily routine, I recommend starting with 1 full glass of water in the morning to get your gut working. Then, in about 30 minutes to an hour, drink celery juice. You can get celery from any grocery store. Organic is preferred, but if you use non-organic products, make sure you wash them thoroughly. For convenience, I get my celery from Costco, usually, where they sell pre-washed packaged celery sticks, but use what you can get in your area. So today I'm going to show you how to make a celery juice. I have celeries here, one from regular grocery store, and the other one from Costco. For the simplicity's sake, I'm gonna use this one. This one is already cut and washed. I already prepped my celery and I have it right here. So I already set up my cold press juicer. Gonna turn it on and show you how it works. So little by little, you put celery in. So I just juiced the whole bag and produce about this much celery juice. I'm gonna divide it into 2 cups. I usually drink 1 cup in the morning and 1 cup in the evening. Enjoy juicing. Cold press machines tend to conserve nutrition and it is relatively easier to use and clean. It just creates less mess for me. You still want to drink water on top of celery juice, but adjust the water consumption if you have leg edema. Another big thing I want to talk to you about is intermittent fasting. In a typical Western diet, our gut is working all the time. It takes about 8 hours to digest red meat. If you eat meat 3 times a day, that means your gut is continuously working for 24 hours, which can be very draining for your body. Healing happens when you have surplus of energy at the end of the day. Eating heavy meals 3 times a day deplete your energy rather than energizing it. Here is an intermittent fasting method that is relatively easy to follow. Basically, you skip breakfast and eat between noon and 8 p.m. In the morning, you can drink water, celery juice, light fruits, but nothing heavy. For lunch and dinner, try to stick to a 70% vegetable diet. For patients with dry eyes, eating omega-3 rich food such as mackerel and salmon can help maintain the fatty layer of the tear film holding the fluid within your eyes. For other protein sources, everybody's body is different, right? Some people have iron deficiency, which can benefit from some red meat consumption, whereas others eat too much red meat, causing weight gain. If you're struggling with weight gain or already have fatty liver, your liver might be working extra hard already to help digest fatty food. In that case, limit red meat consumption to 2 to 3 times a week and replace the protein source to tofu, legume, fish. Also, look for lean meat rather than fatty meat. Don't make it too complicated though. The main thing is to stick with 70% vegetable diet for the anti-inflammatory effect. If you can do that, they will get you the most amount of benefit. The goal is to gradually work on reducing the number of contributing factors for dryness in your day-to-day life. We talked about coffee, energy drinks, alcohol, tobacco. If we do the same thing over and over, nothing will change. If you're a coffee lover enjoying multiple servings per day and have very severe Sjogren's without sugar coating, you may need to ask yourself what you love more, coffee or your body. 1,000 calories from latte versus celery juice will create very different results in your body over a long period of time. As you optimize your health and weight with a plant-rich diet, meditation, and exercise, work with your doctor to see if you can reduce or eliminate some of the contributing medications, such as diuretics, mood medications, or antihistamine if you are on them. As you can see, there are many variables. Please continue working with your doctor in your healing journey. So here's my big theme in healing. There's no replacement for a healthy lifestyle. Give celery juice a try. If you're curious about the taste, some Whole Foods locations have juice bars that can make fresh celery juice for you. I hope you enjoyed this video. Please share it with someone who may find it useful. Thank you.